Hello, everyone. We'll just wait a minute or two to allow people to join, then get started. Yeah, welcome, everyone. I guess we'll make a start now. My name is Olu Akinremi. I'm the senior transformation program lead at NHS. I work within the strategy planning and innovation directorate within NHS. This is the last of our series of webinar that we started about 6 weeks now. And today's webinar is focused on decarbonization of our care pathways. I'll be talking about the tool which we presented sometimes in September, earlier in the year, which we have now moved to an enterprise planning platform to bring out those functionalities for health and care pathways. And we have recorded videos of our previous webinars, so I'll be telling the team to put that in the chat. You can go back and have a look at it. And today's session is being recorded as well. So for today, I'll be doing a bit of the introduction to the tool and giving us a direct maybe application to health and care pathway, asthma in this case. And also we have Keith from Sustainable Health Coalition who will be joining us soon, also showing us the impact they've done in maternity. And I have some our technical team as well were able to give us 5 minutes showcase of the tool, real life showcase of the tool. So yeah, thank you. Welcome, Keith. Can everyone see my screen, please? Okay.
Yep, that's fine. Thanks, Olu.
Yeah. Okay. So, do you want to introduce yourself before we start? Then I'll go from there.
Was that to me? Sorry.
Yeah. Do you want to introduce yourself before we start? Then.
Yeah, thanks. Hello, everyone. I'm Keith Moore. I'm the program coordinator at the Sustainable Healthcare Coalition, and I've been working with Olu and the team at Arden to get this care pathway assessment approach built as part of the approach to net zero. So I'll let Olu do the introduction to what he's been up to, and then I'll talk a little bit about the background to the work that's been going on. Thank you.
Yeah, thank you very much, Keith. So without much ado, I'll just go into introducing ourselves. As a care system support unit, we are sort of a consulting arm of the NHS. We support NHS organization with different in different kind of services. We've got a lot of professional staff that work within NHS that support workforce transformation, digital transformation, clinical strategy, redesign, insight, and other BI, all sorts for the NHS. So we are NHS for the NHS and not a for-profit organization. And just to dig into this, give it a sort of background, this tool was built off the back of the decarbonization objective by the NHS England. And the aim is to have zero carbon emissions by 2050. Was brought about the fact that NHS has about 4% of the country's emission, and which is about 7% of the economy of the country in terms of carbon emissions. So the tool aims to understand the environment, going to the bread and butter what the NHS does on a day-to-day basis, which is patient activities in different health and care pathways, and assess the carbon emission that we have in those care pathways. And not just the carbon emissions, we're also looking at also the other multi-goal objectives. What are the clinical outcomes for the patient? What are the population outcomes? What are the quality outcomes? What's the social value? And also the efficiency as well. And so the tool is not just focused on carbon emission, but it's focused on all these multi-goal objectives. So I will just give us a background of what the carbon footprint is, a report by NHS England, and gives us the carbon footprint of what of the NHS at this point in time, and also the activity types that we have this carbon footprint. So as you can see, we've got medicines, medical equipment, non-medical equipment, other supply chain, building, commissioned health and care pathways, visitors travel, staff commutes, patient travel, and all those. And the good thing about this tool is we've made the tool comprehensive enough to cover these different aspects. What we have out there is people looking at maybe building, looking at procurement in isolation. But what this tool has done is looked at everything from the main activity that the NHS does. from the patient perspective. And we've covered all these emissions from these different angles. And how have we done this? We've looked at patient population activity output. We've looked at the possible emission factors. We've looked at the carbon inputs. We look at the CO2 output as well. And we did this across the community and primary care, emergency services, ambulance, the A&Es, the in-hospital, whether it's planned, secondary care planned, or secondary care unplanned. And also we've done this for distress services and even outpatient services, clinics, also people that go to maybe short-term care, virtual wards, or even long-term care in the community as well. So we're able to assess or overlay different clinical pathways on these particular modules that we have within the tool. And another thing that we have within the tool is we've adapted this to different clinical pathways. And we're able to compare, we can forecast, we can analyze, we can forecast, we can do scenario modeling on this enterprise solution and plan where we have the tool across different and see practice where we have hotspots of emissions across different clinical pathways and create initiatives that we can overlay to make sure we address this issue for the multi-goal objective, of course. And we've done this comprehensive modeling across different services. Another good thing about this tool is we've done a sort of financial into, so we can do carbon cost per patient and also look at for the carbon intensity per pound and carbon intensity per patient as well in the tool, because we've integrated the cost of those activities along different pathways into the tool. So I will stop now before I go into the case study. I'll allow my colleague Keith Moore from Sustainable Health Coalition to come in, give us the impact of what is done across the maternity service, measuring the carbon emissions and the impact is had in the maternity pathway. Then I'll come back to the asthma pathway. Then we have a 5-minute demo from our partners as well to showcase these two. Thank you very much. So I'll stop sharing our case.
While Olu's getting those slides up, I'll just explain who we are in the Sustainable Healthcare Coalition. We were formed about 14 years ago now by the predecessor to the Greener NHS team was the Sustainable Development Unit. The blob map diagram that Olu shared indicated that a lot of the NHS footprint is in its supply chain, and the two biggest blobs in there are associated with pharma and medtech. So if the NHS was going to succeed in moving towards a net zero target, had to get involved the two biggest parts there, the pharmaceuticals and the medical device industries, to understand what the art of the possible was and how we might collectively look for solutions to reduce the carbon impacts of those things. We're there. Thank you, Olu. If you go on to the next slide. So the very first question was, is that blob map right? Are the supply chain emissions what we think they are? And of course the answer was we had no way of measuring it. So on to the next slide, please, Olu. Thank you. The very first thing that the coalition did was looked at ways to answer those questions. First off, bringing forward a standard on how to footprint pharmaceuticals and medical devices for their carbon footprints. And for that, we built it on the internationally recognised GHG protocol. So we've got their tick on there. Beyond that, the carbon footprint of the product itself, be it a drug or a tablet or a vial or whatever it is only one part of understanding the whole of how that interacts with the health system and how that impacts on the carbon footprint of the health that's delivered. So we then went on to bring forward guidance on how to assess whole care pathways, and that is the basis for the work that Olu and the guys at Arden have been doing. We've tried to make it live and make it accessible for people, so we've been doing case studies. to bring forward examples of how this can be implemented and the sorts of reduction opportunities that exist. And now we've been approached by firstly academics and now industry to say, if you consider clinical trials as a special sort of care pathway, can we use the same philosophy, the same measurement techniques to understand the impacts of clinical trials? And we're working on that as we speak as well, bringing forward methodology and tools to help people do that. I want to put it in context. If you just go on to the next one for me, please, Olu. We want to try and make it as accessible as possible through working with partners like Arden and GEM. But there's also a knowledge hub, an implementation hub that we've started developing on our own website, and the link and a QR code's there for that. But also importantly, the idea that calculators can help people to implement this stuff. And the reason for that is that there's a lot of background information that's needed before people can start to generate their own carbon numbers. What we've done with the calculator, and Olu can explain a little bit about how this has been embedded into the work that he's been doing. We've done some surveys of healthcare settings to try and find out what is the emission factor for an ambulance trip or for an outpatient visit or for an inpatient bed day. Once you've got all that in the background, then you can start to build a tool for people to be able to say, well, I've got whatever the pathway is that they're interested in, I've got so many incidents of a 1 hour surgery, so many incidents of a GP appointment, and so on and so on. That way they don't need to worry about what the emission factors for these things are. They can just plug in the numbers for their care pathway and get an indicative answer out of it for them. And I'll put that in the context of some work that we've been doing in maternity services. If you go on to the next one, please, Olu. We've been working with partner organisations, the Centre for Sustainable Healthcare, the Royal College of Obstetricians and Gynaecology and the Royal College of Midwives on an SBRI funded programme of work. I'm sure the slides will catch up with us in a minute. The maternity services are a very high volume service as far as the NHS is concerned. There's 670,000 births across the UK in 2022. So it's a service that is seeing a very high throughput of patients taking that treatment. It's also true that there are quite severe inequalities in how maternity services are accessed and delivered across the UK, disproportionately affecting those from minority and economically disadvantaged. Yeah, we've gone a bit too far now, but that's okay. Leave it where it is. Backgrounds, yeah. It's also true globally that the disadvantaged communities are often the ones that are least resilient, most exposed to environmental hazards, and least able to access the high quality healthcare and services that they need. So that the very fact that climate change is going to be causing additional stresses on health and additional stresses on communities means that those health disparities are going to be exacerbated. So the slide that's on the screen now talks about what we've done in this SBRI project to look at mapping of maternity care pathways and do a carbon hotspot on those, but also look at the health inequalities that are associated with those bits of the pathway. The maternity pathway is massively complicated, so we've broken it down into the core parts of it, and all the way through from antenatal care through the the labour, the delivery process itself, be it midwife-led at home, midwife-led in a unit, or in an obs and gynae unit. All the induction and caesarean options that can be associated with that, all of the prenatal and postnatal health needs associated with complications such as high BMI, hypertension, pelvic floor health, all those things have been rolled into this so that you can try and get an overall picture, thank you, of what's going on. And it's the picture on the left here shows you how we've broken down, mapped out all the activities that go into each part of it. And the map on the left of this slide is the antenatal outpatient clinic and what's associated with that in terms of patient travel, staff travel, utility use, waste outcomes, and the GHG emissions as well. Going through this project, we've had the ability to try and carbon footprint what a maternity service looks like. And the graph on the top right of this screen shows you that per patient, the delivery ward, the delivery part of the programme is the bit that's most intensive. The antenatal bit is quite small, unless there's complications, and you can see the higher bar there, second left, is the one that is for hypertension care. And then, interestingly, all the way through to the end, the infant feeding bit, the difference between breastfed and infant formula in terms of carbon emissions is quite high. And then the graph on the bottom right there shows you the carbon associated with each of those methods of delivery, be it home birth, in a unit, spontaneous birth, or assisted, and then caesarean. So all of this gathering of information and getting the insight from the maternity units that have been part of the programme with us means that we can put out there where the hotspots are in this quite complex care pathway and start to point people towards where the reduction opportunities might be and where the biggest opportunities are to move it towards a decarbonised service. We're going at the same time as this, looking through the issue of quality of care and inequalities, and we've got, I think it's 7 maternity units working with us through a Green Maternity Challenge, and the outcomes of that will be delivered in March, hopefully, so we can discuss those there. But I just wanted to put that on the table as one of the examples of how seeing care through this care pathway carbon lens means that it can point you towards service improvement as well as carbon reduction opportunities. And at that, Olu, I'd better hand it back to you.
Thank you. Thank you very much, Keith. That was really interesting. And can we have our technical team anchor to our partners, please, to do a quick 5 minutes demo of the tool?
Yeah, sure, Olu. Hi, good afternoon. Yeah, good afternoon, everyone. I will try and share my screen. Please let me know once it's visible for everyone.
Yes, we can see your screen now.
Yeah, thanks. Yeah, thanks, Olu, and thanks, Keith. Hi, everyone. So, I think as we have been discussing about, how NHS wants to achieve the decarbonization goal by 2040. So we as partners, right, have implemented a very, not very complex, but running decarbonization calculation engine, you can call it, right, by different pathways and section. And since we have only 5 minutes with us to show you what we have done. So basically, as you can see on my screen, right, currently the platform is Anaplan, and you can see that this is a UX page which the front user or the business user would have a look at, right? And what we can see on this page right now is, right, for example, we are talking about carbon emissions by pathways, right, or carbon emissions by pathway and section. So let me directly take you to one of the pages, right, or dashboards, where we have the capability. So right now, as you can see on the screen, I have I have a pathway management grid, which is nothing but I can see that within my NHS trust, right, or one, in my organization, I have currently three pathways, which is asthma, respiratory, cardiology, etc. What we have done here is that we have given the capability to add additional pathways if required. So you can easily, add multiple pathways for your organization, and then you can, perform your input of the number of patients for that pathway. You can select for that particular pathway, right, which is the sections which it will pass through. So for example, as you can see on my screen down now, I am saying that a person suffering from asthma, right, will have to pass through all these sections of the basically health and care system, right? So he'll have to go to like each of these sections, and then what happens is that in each of these sections, right, there would be some carbon emissions or some greenhouse gas emissions that needs to be calculated based on the, as Keith was mentioning, that each of these sections would have certain activities which we need to perform, right? So currently you can see on this page we have given the capability just to add a pathway, input the number of patients, and then choose which are the sections that pathway will be uh, will follow through. So I would also like you quickly to move to the next page, right? For example, as I said, I want to go, my asthma is applicable to all the sections, right? So if I move to, for example, patient's health help, right, which is a particular section, right? So here you can see on this dashboard again, right? You can see that, okay, for asthma as a pathway, what was your, total carbon emission, right? Uh, and in this particular section, you have like three activities, right? Which is how many patients made call to 111, how many patients made call to triple nine as a number, or how many patients took online education sessions, right? And then you have the cost in pounds basically to calculate the cost, right? And then you also have like the carbon emission factors for all of these activities, right? Where you can where you can basically input the number of patients and then calculate it. Okay, one second. Let me move to, uh, I think I moved to the wrong page, but one second. Sorry for that. So yeah, right now if you look at this page, right? Sorry for the confusion. But as you can see on this page, it's a similar page. You can see some KPIs for this particular section and asthma as a pathway. You can also see that my asthma as a pathway was applicable for all the 8 sections. Right now, I have completed the carbon emissions calculations only for 6 sections out of 8, so 2 are still pending. What you are seeing on this page is you can enter month over month the number of calls made to 111, right? And then based on the emission factors that has been loaded in the system in the backend for this particular activity, the emissions will get calculated and also the cost per patient will get calculated. So this is how you can track your emissions calculation month by month, year by year, right? For each section and each pathway. So we have similar pages for, other sections, and it basically works on the basis of the input, and then we have a calculation in the backend based on the emission factors that you have entered. Now, when I'm talking about emission factors also, right, I would like to go back and show you uh, quickly a glimpse of the emission factors page, right? Here, as I am saying, that you can load in the backend what is your emission factors for each of these activities in each of those sections. The user will also get a capability to basically override the emission factor if they want to. So they can, input their own emission factors and they can choose whether you want to use the default emission factor which you got from some database, or you want to use your own emission factor, to perform the calculations. So this is just like a emission factors maintenance page, you can call it. Now, in terms of the sustainability, right, the one insight which I want to focus on was, so we have also have a section summary page, right? Here we can see that, for example, for asthma as a pathway for the year FY24, right? I can see that my total greenhouse gas emissions by the different sections and the pathway, and I can see like which of these particular sections is contributing. It's a hotspot basically, as Keith mentioned, for which section is a hotspot for asthma as a pathway. So I can see that, for example, secondary care unplanned, or say for example bed occupied, right, is a hotspot and it's generating the major amount of carbon emissions for asthma as a pathway. So we need to go and basically analyze that what can be fixed for bed occupied, or secondary care as a section, and can we reduce these emissions. So for doing that, we would like to, either create an initiative, right? So we also have a capability here. Again, I'm moving quickly because of the time, but we have a capability, right, to manage and create initiatives. So you can create multiple initiatives here, right? You can choose whether that particular initiative is active or not. We can set targets that that particular initiative will reduce the emissions by 50%, say for example in 2030, and for example in 2040 it will reduce by 20%. And then we have like this matrix table where you can input again the percentages of the reduction in carbon emissions based on the initiatives and the sections, and then the other calculations follow. So basically, you will also be able to see in the end a trajectory, like what was your. Let me move to a better page where you can see. So that will be the final page. So if I go to the sustainability plan, here you can see, right, that what is your greenhouse gas emissions based on the emission factors, right? As you can see, like for example, for asthma patient self-help, I am emitting 19.20 tons of emissions. Whereas if I create an initiative, that will reduce my emissions to 12.44. So you could track real time the impact of your initiatives, right, as compared to the baseline emissions. And you could see on the left downside chart, right, which is showing that over a period of 15 or 16 years, I am able to achieve the net zero target, which is like you can see from 24, I am reducing the carbon emissions every year, and you are able to achieve that net zero. So, I mean, you can basically track, monitor, have the status check of your pathways, right? And you can also, as there is a requirement of scenario modeling, or you want to see like what will happen if my emissions increase or if it decrease, you can easily track them real time on this platform. And yeah, this was just one example, but yeah, I would like to end it here and pass it over to Olu.
Thank you very much,
Yeah.
Anko. Looking at our time, maybe I'll just do a quick whiz through of the case study using the same platform. I would just like to point out, bring out some points. So this could be overlaid. These two could be overlaid. Can everybody see my screen now? These two could be overlaid on any clinical pathway, like it has shown us the maternity care pathway. This is an example from the asthma perspective, whereby we could account for every activity achievable pathway across those different modules that Anchor just showed us: patient self-help, primary care, ambulance services, beds occupied in the hospital, emergency care, secondary care, planned or unplanned, on continuing care in the community. And we have different pages that we've done that Anchor has shown us. So I won't be going through all those sections, but I would just like to just drill down further on the sustainability bit for us. Here you could create your net zero sustainability initiative and tracking process. So we have different steps for you to do that across having your baseline, having your target, knowing your gaps, and knowing what you want to achieve in terms of those objectives. So there's a stepwise process for you to do your sustainability plan on the tool and have your target and monitor it accordingly over time. So I would just like to emphasize that this tool again is not just for carbon emission; it's also a multi-goal sort of objective for managing the outcomes for patients. So we're looking at this from the triple aim perspective, whereby we have the social value measures and the care delivery measures being measured on the tool, and we can overlay this on clinical pathways. So I will not take our time any longer. You can contact us, and we are able to talk more about this to different organizations that may be interested. And just to mention, we have put out flyers out there. Claude, if you could put it in the chat for different interest organizations that may be interested in a 4 to 6 weeks free pilot to show the art of the possible on a key priority pathway. Thank you very much for coming, and thank you for listening. And we apologize once again. for going over time. Thank you.
Thank you, Ollie.
Yeah, thank you everyone. Thank you everyone for attending.
Thank you.
Bye.